Alright, so I'm going to be showing you two things. First, I'm going to show you how you're going to be attaching a new colostomy bag and wafer. Alright, so what you're going to need is the wafer. Looks like this. Bag looks like this. You're going to need one of these, a skin protective wipe. Okay, and have this handy. There's a bottle of this upstairs in Isaac's room, and also a bottle down here in the gray bin next to the couch. It's called my magic spray, and a pair of scissors. Okay, so what you're going to need to do is you want, before you remove the old colostomy bag, if possible, hi, you're going to want to just prep this. You're going to want to get this new colostomy bag ready so that once the old bag is off and it's cleaned up, you can wipe and attach the new bag quickly before poop goes everywhere. So what you're going to want to do is, first thing, you're going to cut, yes, Daniel, that's exactly right, see? You're going to cut a diamond shape into this. And the easiest way to do that is just to fold this in half, okay, like that, so that you can see the oval going the long way, okay? And then cut diagonally. So like this, you're going to cut a triangle out, and then it will make a diamond, okay? So you're going to do that first, because this will fit over the stoma, all right? And you want to keep it inside the lines, okay? So once you've done that, then you're going to peel off, there's just backing on this, you just peel off the two sides, and then it peels, it sticks right over this, well, on the other side. You're actually going to attach it to this side, okay? It's going to go like this, right over your diamond shape, okay? And you're going to leave this on, because this is what you're going to take off to stick to Isaac's skin. So leave this on with the hole in it, okay? And this should be attached by now. And that's what you use the scissors for, obviously. Okay? And then once you have that prepped, you can use this to take off the old wafer, the old colostomy bag from Isaac. And it's really easy. It's just a little spray. You just spray it right at wherever you want to take it off, usually the top, so that anything can go down into the bag when you take off the old bag. Just spray it wherever you want to peel it, grab a baby wipe, and then it'll just come off super easy, the old wafer. So this is great, because otherwise it's going to be really sticky and it's going to take a while to get off. So this makes it just peel right off. So this is awesome. So do that. Use this to peel off the old wafer, and then use baby wipe to clean up the whole area. Once the whole area is cleaned up, take one of these skin protective wipes, open it up, and just wipe around his stoma, just as big as the wafer. So just only this area, and just, you know, enough. You don't need to constantly keep doing it. So you just do that, and then once you've done that, you want to quickly grab your set up wafer and bag, peel off this side so that it's sticky, and then you're going to just, and then you're just going to put it right over, you're going to put the diamond just right over his stoma and press down on the sticky part, and then just seal it to him. And you can point the bag whichever way you like, if you want it down, if you want it up coming out of the diaper, if you want it going to the side, it doesn't matter. It's up to you. Okay, and then that's all you have to do. You just press it down, it sticks, and you're good. All right, so that's for the colostomy bag. So this, I just want to show you, if in the unfortunate event Isaac rips off his dressing, which happens, what you're going to want to do is try not to touch anything, first of all. If he ends up pulling up the dressing just straight up and everything's intact, attached to the dressing, just put it back down and then stick this stuff over it, and I'll talk about this in a second. Now, that might not happen to where it would come up so easily. It might just come off and be clumped and just a big mess. All the line could be out, whatever. At that point, everything is dirty. So none of it's sterile anyway. So if you touch it, it's okay. It's just that you don't want to touch anything that's going to go back right next to his, where the line goes in his leg. So if that happens, just try to get it free of any kind of mess. And if the whole dressing is just clumped up and it's just a big, ridiculous mess, then just take that off, throw it away, and grab grab a Tegaderm. These are called Tegaderm film. Grab one of these. It just peels open, okay? And I guess I can just show you. I don't want to waste it though, but grab a Tegaderm, and it peels off right here. You just peel it apart, and one side's going to be sticky, and the other side's not. Obviously, this is not sticky. The sticky side is obviously going to go down on top of Isaac's line. So you want to cover, most importantly, obviously where the insertion site is, where his line goes in, and then if you want to try and make some of his line closer to his leg, or just keep it down so he doesn't keep pulling at the insertion site, then put some more Tegaderm on. So just use as much Tegaderm as you need. Try not to use it all, just in case you have to use some more again. But yeah, just use as much Tegaderm as you need. You know, just stick it down. Try not to touch everything, even though technically his leg is dirty. But anyway, before you do all that, hand sanitizer. Yeah, and don't bother. I mean, you could clean the site with an alcohol wipe or something like that, but I would just say just don't do anything. Just because it's not sterile anyway, and you won't have sterile gloves on and all that kind of stuff. So anyway, in the event, do that. Tegaderm it. You know, cover it up with whatever, a sock or hid the sleeve thing or whatever. Yeah, so that's what you're going to have to do until you can do a dressing change, or until a nurse can come and do a dressing change. So I think that's all for those two things.